Hi, this is an episode of What's in My Bag, Cancer Edition. So, this bad boy here. What do I carry? First thing first is a planner. That way you can keep track of all your appointments, regardless of what chronic condition you have. Gotta be on top of that. And also in my planner, I do something a little that helps me stay on track. Because I need to track my mood, I need to track how much I sleep. Also, if I drink that, how much do I drink? So this is kind of how my layout is, if you can see. And how I do it, probably not. But I put in a section called I slept from this time to this time. Total number of hours, if I pooped that day, if I drank 6 glasses of water. Also, I write down all my appointments. And then I make comments on like my morning, afternoon, and evening mood, and also just a list for a gratitude practice. So that's kind of like upside down or reverse or whatever, but just to give you an idea. So this has been really helpful. Just always have a backup of like all your appointments and things like that, plus important phone numbers. Plus, I also treat it as a journal/planner. So we got this down. Let's see. Next, we got drugs. So, this is like my little pill box. Super cute, right? One side is just over-the-counter meds. The other side is prescription. And I made sure to put a label of what's what. Like door number 1 is my compazine. Door number 2. So that's pretty much what I got. Also, the good thing is sometimes I'll write what the pill looks like. For example, Zofran, it looks like the little orange skinny pills. So you can either look it up online on drugs.com for whatever reason, if you forgot what your pills look like and they open up, or your prescription bottle will also tell you. So if I can, will also tell you on the back too. Like for example, this medication, it says white round tablet, imprinted with a number on it. So yeah. But at the end of this, you probably know all the drugs I'm taking. So at least for nausea, you know. So I've got it labeled. You want to make sure you know what opens each door, right? Door number 1, door number 2, so forth. I would write down the name of it, how many milligrams, how the directions on it for sure, and even a small little tidbit on what the pill looks like if you wanted to. You could put this on the actual pill box, or you can write it on an index card as like a little key. So that's that. Talked a lot about that. Next, what else I got up in here? During times like you're sweating a lot, if you're vomiting, diarrhea, all that good stuff, right? You're losing a lot of electrolytes. So sometimes people just have like packets that they can put in. Like or rehydration solutions is something what's called, or like electrolytes. So instead of like carrying around like a giant bottle or something like that, I can put this in there if I need to in a pinch. Let's see. Also, I was told that some of the medications might leave like a metallic taste in my mouth, and I might not enjoy eating as much. But if you do have that side effect of like metallic taste, it helps sometimes to actually like eat with like a plastic spoon, or like instead of like silver utensils. Makes sense, right? This here is a spork, so let's wait. Also, I kind of, as you can see, I'm not a big person. Sometimes I do struggle with like low blood sugar, so I like to get like actual real sugar, like candy in here. That kind of helps. Because if my stomach's completely empty, I'm more likely to be nauseous as well, and cranky. You guys don't want to see me mad. But here you go. So these are like my little coffee pills, right? Not coffee pills, but coffee candies. I love coffee, right? It gives me a little caffeine boost. But this is actually most important. So these little pills, these little candies, I keep calling them pills, but these little candies here, they're ginger. Ginger helps speed up gastric motility, also helps with digestion, also helps reduce nausea. So go get you some ginger candy, ginger tea, anything like that. Pregnant women do it when they feel nauseous. When you're switching medications and it makes you nauseous, just anybody really. So just a fun tidbit about that. So I have a lot of stuff back in here. You can see. So I got this. So I've got money, so I can bribe the nurses to go pick up my DoorDash or Starbucks, right? You need that. You need self-protection. Any of my viewers are female or dudes, you live in a sketchy neighborhood. I don't know. I don't judge. This thing is beautiful. So this taser, right? It's got a built-in flashlight. It's got a built-in alarm. And of course, it can tase somebody if needed. You know, sometimes it's better to ask for forgiveness and permission in certain scary situations, you know. And also, it has a way to deactivate it. So with this thing off, you can't tase anyone. But when this pin is in, you can. And then you could just plug it in the wall. So this is like good for like self-protection. Like if you go out, you're like walking your dog or anything like that, it's good to have this. Because usually I would recommend not to walk around at night, but you got to, dog got to go, so this is good to have. Also, if if there's an aggressive dog that you have, just the sound of the taser itself. I'm not saying you gotta tase the dog, but the sound of it freaks them out. So if you try to get between a dog fight, never do that. You're gonna have permanent damage to your hands or whatever, plus crazy infection or whatnot. Unfortunately, you just gotta do your best just to prevent something like that. So a taser is good at the dog park, right? You see somebody who's not watching their dog correctly or is not well trained, I usually will just leave the dog park. I don't even want to deal with that drama. Or unavoidable, you got a taser that the sound of it is enough of a warning and the alarm. That'll make all the dogs freak out. So just so you know, don't ever get in between like a dog fight or anything like that. It's not worth it. Next, because they're immunocompromised, I think you already knew what I was going to say. You need a mask, right? This one's black, very fashionable. Also gloves, very important. So after you get your chemo treatments for the next like 48 hours, there might be large traces of like chemo metabolites in there. So as a result, that stuff that's like coming, like the chemo stuff that's coming out, metabolized and coming out in your urine, in your vomit, and just any like major like body fluids. So mostly you're talking about like feces, urine, vomit. That's where it has like a significant amount of those chemotherapy metabolites. You really want to limit exposure. You're gonna have to, like, when you use the restroom for the first 48 hours at least, double flush, you know. Also, if anyone's trying to help you, you know, like a caregiver or something, make sure they're wearing gloves. You don't want them exposed to that stuff, because that's really not good for their health, you know, really bad. So chemotherapy metabolites, right? That's why you got those gloves. Also, let's say if you're really big into aromatherapy, peppermint and lavender is really good. So lavender is really good for like relaxation, and peppermint's the best thing for nausea. But you can still use lavender as well, but just studies have shown like peppermint works best for people. And what you do is, with essential oils, you don't put it directly on your skin. You can put it on like a cotton pad or something, or tissue. If you're going to use it for like inhaling it, just to like for aromatherapy, right? You don't have to carry around a giant diffuser. You can just do that. So just FYI, some people like the holistic natural stuff, so that's nice. And also, it is effective, right? Let's see, what else I got? Oh, alright. I never said this was going to be a short video, ever. And got some other stuff here, other goodies. Alright. So, hand sanitizer, right? Cuticle oil. It's just because my hands personally are always dry. Anything that's scented is more drying than not, so try to get unscented products if you're really caring about like moisture, like so Bath and Body Works. I'm sorry, those things will dry out your skin. You might just give it away to somebody else. This, you know what this is. Anyway, always need it. Let's see. Altoids. So just in case you've asked somebody cute visiting. But most importantly is if you get nauseous, these Altoids they have a lot of actual peppermint oil on it. So like I said, that calms down your stomach, your intestines. Also helps you with nausea if you're feeling really nauseous. And you can find these at any gas station. You feel really sick, just like go to a gas station, you know, finish your puking, and then just take tiny sips of like water or like even like soda or something like that. Lemon lime, ginger ale, like those are okay. Gatorade, you can find all that at the gas station. Plus this, right? Tiny sips if you've been like puking, you know, until once you're ready. And usually too, like cold water on your face, that helps if you're feeling really nauseous. Also, cold water on your face helps if you're feeling really anxious as well. So it's a lot of things it helps with, you know. So gas station got you covered. If something like that happens, you're unprepared for it. And like I said, whoever's helping you, make sure they're wearing gloves, because for first 48 hours, those chemotherapy like metabolites, you gotta be careful about. You know, that it can really harm someone else's health. So, all right. What do I have? Because even baddies get saddies. You don't want anyone to watch you cry. Just kidding. So this is good, just because, you know, eye protection, right? Next, you got earplugs to muffle out all the haters, but mostly because I like to read a lot, so this helps me concentrate. Also, if you have any sensory issues, like if you have autism or you get ADHD and a lot of like external stimuli is too much, I always carry these. You know, people don't know how to shut their mouth sometimes, so you gotta do this. You can't control what other people do, say, or do, so you gotta put this. Sorry, I had to be negative, but it is what it is. So you block out the haters, and now you don't gotta see them. So we got those two. And also, cry when that doesn't work. I'm a very sensitive person, so I got both. Even baddies get saddies, folks, and it's okay. Don't feel bad. It happens to us all, especially when you're going through like a lot of like traumatic stuff, like medical treatment and stuff like that. You know, you're going through a hard time. Give yourself grace. It's okay. Like if your moods are up and down, it is what it is. You're going through a lot. You know. Let's see what else I got. All right. I've got the best doctor in the world, because she just wrote me a prescription for a wig. So that means, like, first ask your doctor for an actual prescription, and they'll write it up all fancy and stuff, and write their signature on it. And then afterwards, like, you go to a store that like accepts, accepts that, like a medical wig place or whatever. Just Google it, and then they'll help process it through your insurance. But you need a doctor's order for this stuff to get covered by insurance, if it is covered by insurance, right? Do you like my wig? Okay. All right. Now this stuff is like more boring. People don't really care about, but I want to be honest, right? So lotion, right? Unscented. I'm telling you, that's less drying than the scented stuff. I'm gonna get canceled by Bath and Body Works. Also, this is just me if my face gets greasy or whatnot. Alcohol pads, you can like clean off your computer, your like phone screen and stuff. It's good to have. Also, old school nurse trick is like you get these, you huff it, right? That can help with nausea if you don't have anything like on hand, But you're not gonna have to do that probably. You got too much stuff to help with it. So you got this. This is my favorite perfume. Also beauty related. I mean, I know no one's gonna actually see me, right? It doesn't matter like if I look pretty or not, but I still want to look the best I can, whatever stage that I'm at. So I've got this. This is lip stain. So you know how if you like eat like popsicles or drink wine and stuff, it stains the lips. So the color's still there even after you eat and stuff. So I like this one. It's pretty cheap. Got this at like at Ulta, right? A lip stain. And then also chapstick, of course. And also due to chemo, like I said, the hair loss, it could have, that could be a potential side effect, more often than not. So that includes like your eyelashes and eyebrows. And I mean, honestly, I feel naked without my eyebrows. So I had these bad boys like tattooed a long time ago. But if you never had them tattooed before, like, you can use eyeshadow to shape your eyebrows, or you can use like a really good eye pencil. Usually with an eye pencil, you want to get one shade lighter than your actual like hair. Don't want to go too dark. You don't want Sharpie eyebrows, right? So make sure you don't go too dark with your makeup when it comes to drawing out your eyebrows and stuff, because they frame the face. They're like, that's why they're really important and people look so much different without it. Yeah, I love this thing. Yep, it's even got a nice little point to it. So let's see. So I got my tattooed on because I can't make them symmetrical. So if you get that problem, like afterwards, like later on in life, you can get them tattooed. It's cosmetic tattooing. So the needle doesn't go in as deep, which is kind of cool, right? But they fade out every like 3 to 4 years or more often. If it's like a lot of sun exposure, it will fade it faster. Or you can just use, like, if you're new to makeup and stuff, you got chemo, all your hairs fell out, you still want to feel pretty. They got stencils for eyebrows, right? That you can use eyeshadow, or just go really light with this. Just a lot of YouTube tutorials, or like somebody can. There's always somebody who can help. The ladies at the beauty counter, come on, right? So, if that bothers you, a little bit of eyeshadow, a little bit of eyebrow pencils, whatever. This is my like liquid liner, because like Amy Winehouse, I feel naked without anything. So, heck yeah. Let's see. So that's all my beauty tips for now. And also, this is too heavy to have, but this book you should definitely get if you have breast cancer or think you might have it. So it's Dr. Susan's Loves Breast Book. And this book is like the Bible for like women with like breast cancer. So this stuff is written in a way that the general public can understand. I hate a lot of medical jargon, right? I don't like that stuff. I want things to be easy to understand, straightforward, to the point, practical, right? You got this. Because Dr. Susan Love, she's a really famous like oncologist. And so the ways it's pretty much laid out, like part 1, the healthy breast and common problems. Part 2, what causes breast cancer and how we can prevent it. Part 3, diagnosis and screening. Part 4, decision making. So that kind of helps when it comes to deciding, like, okay, my doctor gave me all these options, like what should I think of, or what kind of questions to ask, right? So she goes through like, okay, like different types of surgeries, medications, things like that. She'll go through all of it. And also part 5, treatment in the age of personalized medicine. So then she talks more about like radiation therapy, systemic therapy, lifestyle changes, things like that. Reoccurrence is part 6, when cancer comes back, living with reoccurrence. And like, so anything you want, just go ahead and, this book is thick, but I'm not saying you got to read it from beginning to end. I'm just saying, like, this is very helpful. If you're diagnosed, you got a lot of questions, you're kind of overwhelmed, this will definitely like help a lot. Like, no matter like what stage you are at for your diagnosis. So it's here. It's very easy. Don't better than Google. Gonna listen to the actual oncologist, man. So that's it for now. I'll probably do another video soon too about like how to deal with some of the side effects that I mentioned as well, like more in detail later.